Hi everyone, this video is part 2 of the 5B series on treatment and health. This particular video will focus on the different approaches to psychotherapy. So as you can see on our unit outline, we are currently in the topic titled 5.5 Treatment of Psychological Disorders. You'll notice that today's video will follow two key focus questions. They are, what are the different approaches to therapy and what techniques are used in each approach? These are the vocabulary concepts that I will explain throughout today's video. By the end, you should be able to define and describe them. So before I dive into the different approaches to psychotherapy, let's start with the basics. So what is therapy? Well, in everyday language, therapy is usually a shorthand for psychotherapy. So when someone says they're going to therapy, they usually mean that they're seeing a mental health professional, someone like a psychologist, a counselor, or a therapist for talk-based treatment. Psychotherapy is the more precise word because therapy itself could also encompass things like physical therapy or speech therapy or occupational therapy. So, this is referring to a mental health treatment that involves talking to a trained professional to treat emotional or psychological challenges. And the main goals of psychotherapy are to reduce stress, improve daily functioning, and promote personal growth. There are several different approaches to psychotherapy, and each one is based on a different psychological perspective. Some will focus on unconscious conflicts, while others will focus on changing behavior. And some are looking at how to help build the most positive sense of self. So many therapists today take a broader approach. It's called the eclectic approach. And that just means they're taking a blend of techniques from different therapy perspectives based on what works for the individual. One approach to psychotherapy is called psychodynamic therapies. These are therapies that are based on the idea that unconscious thoughts, unresolved conflicts, and childhood experiences are shaping our current behavior and emotions. So, the main goal of this type of therapy is to help clients bring hidden influences into conscious awareness so the patient can understand them and work through them. One common technique in this approach is called free association. And in a session, the therapist using free association would encourage the client to speak freely and openly, sharing any thoughts or words or memories that come to mind. The therapist will listen carefully for any reoccurring themes or any slips of the tongue or any emotional reactions that might point to an unconscious conflict or suppressed feeling. Another technique in the psychodynamic approach to therapy is the use of dream interpretation. Psychodynamic therapists believe that dreams can hold symbolic connections to the unconscious mind. So during therapy, a client might be asked to describe the content of a recent dream, and the therapist would analyze it for possible meaning. Another technique is called hypnosis, and this also fits in line with the psychodynamic approach to therapy. Hypnosis can be used to help clients enter a deeply relaxed and more focused state. In this state, clients may be more open to suggestion and better able to access feelings that are difficult to reach when they're fully alert. Hypnosis is a therapy technique that's been seen to be effective in reducing pain and anxiety, especially when it's used alongside other therapies. But it's also important to know that while hypnosis can increase a person's willingness to talk, research shows that it does not reliably produce accurate memories. In fact, people under hypnosis are often more suggestible, meaning that they may unintentionally create false memories or become convinced that imagined or distorted events actually happened. This is particularly problematic when hypnosis is used to try to recover repressed memories, as these memories might feel very vivid and very real, but they can be inaccurate or entirely fabricated. Similarly, the idea of age regression through hypnosis, where someone is guided to mentally return to a younger age, is not supported with evidence. Though a person might act or speak like a child under hypnosis, studies show that this is more like role playing or imagination, and it's not a true return to a younger mental state or a true way to access childhood memories. So, hypnosis might feel real and intense, but it's not a reliable tool for uncovering factual pasts. Next is humanistic therapies, and these focus on personal growth, self awareness, and reaching one's fullest potential. Humanistic therapy views people as inherently good and capable of making meaningful change. The goal is to help the client to become their most authentic, fulfilled selves. This approach was developed by Carl Rogers, who believed that people thrive in an environment that offers support, acceptance, and understanding. One of the most well known forms is called person centered therapy. In this type of therapy, the client Not the therapist leads the conversation. The therapist acts more like a guide than an expert, creating a space where the client feels safe to explore their feelings and experiences without judgment. This might sound a little bit similar to the psychodynamic approach of free association because the patient is doing most of the talking. However, in person centered therapy, the client is leading while the therapist just is offering support and acceptance and guidance. Whereas in free association, the client will talk freely and then the therapist is analyzing to look for hidden meanings. A key technique in the humanistic therapy approach is something called active listening. Active listening is done by the therapist and they will pay very close attention to what the client says and then reflect it back, sharing what they heard. So it might sound something like this. It sounds like you felt really alone in the moment. Or what I hear you saying is that you felt really misunderstood. Is that correct? And active listening helps clients feel heard and it encourages them to have deeper self reflection. Another essential element is something called unconditional positive regard. And this is when the therapist shows complete acceptance and support for the client, no matter what they share. And this doesn't mean that the therapist always agrees with the client, but it means that the client knows that they won't be criticized or rejected by their therapist. And this kind of emotional safety helps clients open up and it helps them have more personal discoveries. Overall, the goal of humanistic therapy is to create a warm, supportive environment where clients can gain insight and build self esteem and move toward personal growth. Cognitive therapies are based on the idea that our thoughts significantly influence how we think and how we feel and how we behave. So, cognitive therapies attempt to improve mental health and well being by identifying negative or irrational thinking patterns. A key concept of cognitive therapy is called the cognitive triad. This concept was developed by psychologist Aaron Beck. The cognitive triad consists of three negative thought patterns. One is how someone views themselves. The second is how they see the world. And the third is how they envision their future. And together, these distorted thoughts can create a pessimistic and harmful outlook. And it can often lead to anxiety and depression. So, cognitive therapists focus on identifying and working through these challenging beliefs. One technique a therapist might use is called cognitive restructuring. This technique helps the client recognize their distorted thoughts and then replace them with more balanced alternatives. For example, a person who believes, I always fail, might then learn to reframe that thinking pattern as I may fail sometimes, but I can learn to improve. So, cognitive restructuring is collaborative. So, the therapist helps the client notice the thinking patterns, they examine that thought or belief together, and then they come up with more realistic alternatives. Another technique used in cognitive therapy is called fear hierarchies, and these are used especially when treating anxiety. A fear hierarchy is a very common tool where a client will be asked to make a list of stress inducing or fearful situations from least to most anxiety provoking. And the goal is for the client to start at the bottom of the ladder of the hierarchy and gradually face each situation, starting with the least distressing and learning how to cope with that and then manage their way up. Applied behavior analysis is a broad therapeutic approach that uses the principles of learning, especially classical and operant conditioning, to change behavior. This approach focuses on modifying observable behaviors by reinforcing the desired ones and reducing the unwanted ones. Once a client identifies specific stressors in their fear hierarchy, they might begin treatment with exposure therapy. And this is a process that involves gradually introducing the person to the feared objects or situations in a safe and controlled way. This repeated exposure helps to eventually reduce the action of the sympathetic nervous system, and it teaches the client that the feared outcome is unlikely or that it's manageable. A type of exposure therapy is called systematic desensitization. And this is where, as the person is working up their fear hierarchy, they are pairing each level with a relaxation technique. So the goal is to replace the anxiety with a calm and relaxed state, or to pair that stressor with something positive. The client begins with the least anxiety provoking stimulus. So if they have a phobia of dogs, they might start by looking at a picture of a cartoon dog. And as they work their way up, they're going to practice a relaxation technique with that object, gradually moving up each level to more challenging levels, like watching a video of a dog and being in the same room as a dog, and then eventually being able to pet a real dog. And at each level, they're practicing their relaxation techniques. Virtual reality is increasingly being used as a tool in exposure therapy, and it allows clients to encounter simulated versions of a fear in a controlled environment, like flying in an airplane or standing on a tall building. Virtual reality makes it possible to practice exposure in realistic settings, even when in real life, having exposure to that particular situation, it might be impractical or it could be too distressing. The next two techniques of applied behavior analysis are called aversion therapy and token economies. Aversion therapy is a form of classical conditioning, and the goal is to create an association between an unwanted behavior and something unpleasant, ultimately eliminating the behavior altogether. One example of aversion therapy that you might be familiar with is specifically designed to stop nail biting, and this is a nail polish with a bitter taste. And the goal is to associate that bitter taste with nail biting to eventually break the habit. Token economies use operant conditioning through positive reinforcement to increase a desirable behavior. Individuals earn tokens like stickers or points for good behavior, which they can exchange for rewards. And the choice board that you see pictured on the screen comes from a website called The Autism Helper, which is a site that's created by behavioral specialists who provide support to teachers and parents and clinicians and administrators who are working with individuals with autism. And this approach is often used in schools to help promote responsibility and cooperation and encourage the positive behavior. Another applied behavior analysis technique is called biofeedback, and this is used to help individuals gain voluntary control over their automatic body functions by using real time feedback from monitoring devices. It's based on principles of operant conditioning, where people learn to change their physiological responses through reinforcement. During biofeedback sessions, sensors are placed on the body to measure functions like heart rate, muscle tension, and skin temperature, or even breathing rates. And this information is displayed on a screen, allowing the person to see their body reactions to stress or relaxation in real time. The therapist guides the client through relaxation exercises such as deep breathing, progressive muscle relaxation, or mindfulness techniques, while the client watches how their body responds. And over time, the client learns how to control these responses without the feedback equipment. Biofeedback is often used to treat anxiety, chronic pain, tension headaches, and high blood pressure by teaching clients to activate their parasympathetic nervous system and reduce those physical symptoms of stress. Cognitive behavioral therapy is a therapeutic approach that combines principles from both the cognitive perspective and the behavioral perspective. The goal of CBT is to help clients modify unhelpful thought patterns and behaviors that contribute to emotional distress. CBT is effective for treating a wide range of mental health concerns like anxiety, depression, PTSD, eating disorders, and so much more. CBT can widely be used across many conditions. In therapy, clients work to identify negative or distorted thoughts, which are called cognitive distortions, evaluate their accuracy, and then replace them with more balanced and rational beliefs. And by changing how they think, clients can also change their behaviors, which are probably also reinforcing that emotional distress. Now, one form of CBT is called dialectical behavior therapy, or DBT. And this was originally developed for people with borderline personality disorder because it focuses on addressing intense emotional swings, unstable relationships, impulsivity, and chronic feelings of emptiness that are characteristic of borderline personality disorder. DBT emphasizes balancing acceptance with change. Clients learn practical skills in four key areas, and those areas are mindfulness, emotional regulation, distress tolerance, and interpersonal effectiveness. Next is rational emotive behavior therapy, or REBT, and this was created by Albert Ellis. And this focuses on identifying and confronting irrational beliefs and thought patterns. These can often be very fixed and rigid. They can be extreme, unrealistic, or self defeating thoughts. In therapy, clients examine how these irrational thoughts lead to emotional reactions, and then they learn to challenge them and replace them with more logical and rational thinking. Now, I think REBT, or rational emotive behavior therapy, sounds a lot like cognitive restructuring. And so, one way that I see it being different is that it is more direct, it's more structured, and it's more confrontational. The therapist will challenge irrational beliefs head on, telling the client something very straightforward, like that belief is unrealistic and it's harmful. So, rational emotive behavior therapy is rooted in the idea that many of our emotional issues or challenges come from rigid, irrational demands that we place on ourselves or on the world. Now, to contrast that with cognitive restructuring, on the other hand, is typically more collaborative and it's a little more gentle. It's going to involve the client working alongside the therapist to evaluate their thoughts and come up with balanced alternatives. In that situation, a therapist might talk about, like, what is the evidence for that thought? And is there another way of looking at it? And so they're going to work together to restructure that thought process. Rather than in rational emotive behavior therapy, the therapist is going to confront it head on and address it as an irrational thought process. All right, so that brings us to the end of today's video. Let's do a few short questions for review. Remember, I'll read the question out loud and then you'll need to pause the video to determine the answer. Question number 1 says, James has a strong fear of elevators. His therapist helps him create a list of anxiety triggering situations related to elevators, starting with looking at a picture of one and ending with riding in a crowded elevator. James gradually works through each step on the list while practicing breathing and relaxation exercises. What technique is his therapist using? Question number 2 says, during her therapy session, Monique is asked to sit in a relaxed position and talk openly about whatever comes to her mind without filtering or organizing her thoughts. Her therapist occasionally asks questions or encourages her to explore specific memories, attempting to see if any conflicts from the unconscious arise. What technique is her therapist using? And question number 3 says, in therapy, Elena is taught to recognize when she engages in negative self-talk, like saying, I'll never succeed, or no one likes me. Her therapist helps her consider the harm of these automatic thoughts, and they work together to come up with more constructive beliefs. What technique is her therapist using? So this brings us to the end of today's video on different approaches to psychotherapy. On the left-hand side of the screen are the answers to the review questions, and on the right-hand side of the screen are the questions and major concepts. Before closing out, take a moment to check your understanding of the essential elements of today's video.